Hello, everyone, and welcome to the fourth Blue Bag Lunch of March, CRC Awareness Month. I'm Stephen Bushong with the Colorectal Cancer Alliance, and I'm so glad you're here today. Today's program is all about innovation, from a new way to screen for cancer to the benefits of robotic surgery, and from greater sensitivity of recurrence with ctDNA testing to expanding access to clinical trials. You'll want to hear from our experts today about ways their organizations are pushing the envelope toward better health outcomes for all. We will follow the path of a typical patient and begin with colorectal cancer screening and an exciting development that is just on the horizon. But before we begin, I want to note that representatives of these companies featured here today are watching the comments. So please feel free to ask questions there if you have any. And as always, share this stream so your friends and family can benefit from all of the knowledge that is shared here today. Now, I am pleased to welcome Dr. Demetria Tenefos of Guardant Health.
Hello, everyone, and thank you for joining today's webcast. I'm here to discuss one of my passions, preventative healthcare for patients, and the emergence of new technology in our fight against colorectal cancer, specifically blood-based colorectal cancer screening. As you're probably aware, colorectal cancer is the second leading cause of cancer-related deaths in the United States. The good news is that we can dramatically improve survival outcomes when it's found early through on-time screening. For example, 5-year survival rates for stage 1 and stage 2 cancers is approximately 90% compared to only 14% in stage 4. The bad news is, despite there being multiple screening options available, they're not being taken advantage of or completed nearly enough. 1 out of every 3 adults who are eligible for colorectal cancer screening are not up to date with it, which amounts to nearly 49 million Americans walking around this country right now unscreened. We know that patients face numerous barriers to completing traditional colorectal cancer screening methods. Not everyone can take off work for a colonoscopy, for instance, or if they live in rural communities, they may have to commute a long distance to get their screening done. If we want to improve colorectal cancer screening rates, it's clear we need another option. Guardant Health has been committed to delivering on that, and over the last several years, we've been developing and validating our blood-based cancer screening test. This blood-based test option could help us address many barriers that have historically limited people's ability to access screening or participate in screening. And here's how. You can get a simple blood draw to screen for colorectal cancer during any doctor visit. It requires no special prep, no dietary changes, no sedation, no extra time away from your family or from work, and it can be completed at most primary care office visits. With a blood test, patients can essentially be reached right where they are. And based on a survey that we conducted at Guardant Health last year, we heard from patients that they're eager for a blood test. Nearly 64% of patients indicated their preference for a blood test over other screening modalities. At the end of the day, the best test is the one that gets done. If patients are more open to a blood test, we have a better chance of reaching those who have historically remained unscreened. So you may be wondering, how does something like Guardant's blood-based test work? As cancer tumors grow, they release their DNA into the bloodstream. Our blood test looks for this DNA called circulating tumor DNA. We also refer to it as ctDNA, to identify signals that are associated with colorectal cancer. If these signals are present, our test flags the patient as needing a follow-up colonoscopy to determine if colorectal cancer is present. This blood-based screening test, like other methods, is designed for those who are average risk, asymptomatic, and anywhere from between the ages 45 to 84. It's important to note that if you are high risk for colorectal cancer, whether that's based on your personal or family history, or you may be experiencing symptoms, you're not eligible for the blood test. A colonoscopy is recommended from the get-go for you or in patients with these symptoms. The idea is that the blood test would be one more option to offer average risk people, especially those who have not performed screening in the past, and get them engaged by making screening more approachable and accessible. In terms of timing for the availability of our test, I'm excited to share that we completed our 20,000 patient clinical study to evaluate the performance of our blood test, known as SHIELD, in detecting colorectal cancer, and we submitted that data to the FDA just last week. If we're successful, achieving FDA approval will then be covered by Medicare, opening up access to the Shield test for millions of individuals. But we won't stop there. We will also be looking to get an endorsement from the United States Preventative Service Task Force over the next few years, which once included in their guidelines would further expand payer coverage, private payer and Medicaid coverage. So in the meantime, while we're looking to achieve these milestones, we're partnering with select healthcare providers and health systems on various pilot studies across the country to gather more insights and learning on how Shield is impacting the screening landscape. What we're seeing so far is really promising. We're reaching thousands of people and seeing a 90% adherence rate, far outpacing the current adherence rate of 65% across all screening modalities. It's a simple blood draw, but a revolutionary test, and one that we hope will help close the screening gap once and for all. I really hope this short session inspires hope for you as we look to the future for colorectal cancer screening and know we have an additional tool in our toolbox to get eligible patients screened. We'll keep all of you and our advocacy partners like Colorectal Cancer Alliance in the loop on our progress, but if you have questions, you can visit bloodbasedscreening.com to learn more. One day, we envision a world where people do not die from colorectal cancer. And at Guardant, we're dedicated to playing our part and helping us get there. We're so excited about the potential impact of blood-based cancer screening, and we encourage you all to share this new innovative technology with your family and friends. Be sure to stay up to date with your own screening in the meantime. Thank you so much for taking the time to tune in today. Back to you, Stephen.
Thank you, Dr. Tenna-Foss. After a diagnosis, most patients will encounter surgery. It's the most common type of treatment. You might want to remember that for later. Open surgery has long been the typical method for removing tumors. During open surgery, the surgeon makes a large cut into the abdomen, and these large incisions can affect recovery time. Recent technology has allowed new laparoscopic and robotic techniques. These are considered minimally invasive surgeries because doctors make smaller incisions that can decrease recovery time. Robotic surgery is the newest of these advancements, but still, more than 1 million people have already benefited from this method of surgery. I'm delighted to introduce board-certified colorectal surgeon, Dr. Melissa Chang of Trinity Health IHA Medical Group to tell us more.
Thank you so much, Steve, and the Colorectal Cancer Alliance for the opportunity to be here today. I would love to discuss with you, in general, from my perspective as a colorectal surgeon, how we treat our colorectal cancer patients. Obviously, colorectal cancer screening is paramount. It is a huge cornerstone in terms of really being preventative and saving lives in terms of colorectal cancer. We know the impact of colorectal cancer in our population and with increasing diagnosis in a much younger population. So in terms of how our group approaches the care of colorectal cancer patients when it comes to surgery is we utilize an intuitive Da Vinci surgical robot in terms of performing minimally invasive surgery. This opportunity to use this device allows for enhancement of minimally invasive surgery by making small incisions through a port site no larger than my index finger to gain entry into the patient's abdomen. By doing so, we insert small instruments that essentially act as an extension of my hands. So through those small incisions, we have instruments that can articulate like my wrists. I am performing the surgery at all times. Patients do ask me if I leave the room and that the robot is performing the surgery on autopilot. That is never the case. I am the surgeon that is utilizing this robotic platform to perform the surgery at all times. By utilizing this technique in terms of what we know about the impact on patients nationally, we know that this enhances our ability to perform minimally invasive surgery, the reduced risk of having to convert to an open operation. And with that comes all of the benefits of minimally invasive surgery, which means a lower length of stay in the hospital, getting patients home or onto their recovery as quickly as possible. This allows them to have improved overall resumption of bowel function as well as normal activity and eating. Our hope is to allow patients to regain their baseline as quickly as possible to minimize the impact on their overall quality of life and get them on to adjuvant therapy if that's what's needed. Some may compare this to laparoscopic surgery versus robotic surgery, and honestly, any minimally invasive surgery will confer the same benefit for our patients. We do know that in terms of national data, looking at databases throughout the country, that patients are 4 times more likely to have an open operation or a conversion associated with laparoscopic surgery versus robotic surgery. And so for our group, knowing that information, we do advocate the use of robotic-assisted surgery in our hospital and with the treatment of our patients. In terms of finding a robotic surgeon near you, there is the opportunity to go to the Intuitive website where you can find a surgeon in your near location. There is also the opportunity to find that information on the surgeon's website or through their institution. And always, when sitting down with your surgeon and meeting with your surgeon, it is our role to serve and support our patients. And so important to ask your surgeon, how is the surgery going to be performed? What are the potential outcomes that you've seen? What can I expect during my perioperative course in terms of how long I'll be in the hospital, when I can expect to get back to my overall baseline? Again, we are in partnership with all our patients, and we are hoping to achieve the best outcomes possible in their colorectal cancer journey. And thank you all so much for the opportunity to be here today. Happy Colorectal Cancer Awareness Month. And remember, get your screening. Thank you.
Thank you, Dr. Chang. Once surgery and possibly adjuvant therapy is completed, a patient is on the road to recovery with frequent checkups to ensure there are no signs of cancer coming back. To date, most people rely on scans, CEA blood tests, and follow-up colonoscopies for this information. But what if there was an additional way to know whether something serious was happening in your body, even earlier than those methods usually allow? To tell us about an innovation just like that, please welcome Dr. Haley Whitten, GI Oncology Medical Science Liaison at Natera.
Thanks, Stephen. My name is Haley Whitten, and I'm our GI medical expert on the medical team with Natera. We know that when it comes to colorectal cancer, no 2 patients are alike. Thankfully, over the last several years, diagnostic testing has evolved to become more personalized and patient-specific to help guide treatment decisions for patients with colorectal cancer. For instance, tumor genomic profiling is being utilized to target specific mutations within the patient's tumor to help clinicians determine which drugs will be the most effective at attacking a patient's individual cancer. Hereditary cancer testing is also being utilized to help identify which patients have inherited mutations and may increase their cancer risk. Hereditary cancer mutations may also influence which treatments are most effective in treating specific types of cancer. As much as these tests have evolved to improve patient care, they tend to fall short when it comes to identifying if there is any cancer left in the body after surgery, if a patient is responding to treatment, or if the cancer is coming back. Tools like imaging and tumor markers like CEA can help provide insight if there is cancer lurking, but unfortunately, they don't tell us the whole story and can be elevated for reasons not associated with cancer. We are at the tipping point in precision medicine where more personalized approaches to cancer management are being embraced to potentially improve both a patient's response to treatment as well as improve their quality of life. Signatera is a personalized blood test based on individual patient's tumor tissue that can help answer the questions about the patient's cancer journey. Signatera is a test looking for circulating tumor DNA, or ctDNA, which is like looking for a needle in a haystack. In a broader sense, this needle can be formally called molecular residual disease, or MRD, as it's microscopic pieces of DNA that are shed into the bloodstream directly from the patient's tumor. With Signatera, we can now answer the questions in looking for if there's any tumor left in the body after surgery, evaluate the patient's treatment response, and detect relapse earlier to help win the war on cancer at the individual patient level. In addition to Signatera, Natera also offers the other key aforementioned genetic tests, which include hereditary cancer testing with our test called Empower, and Altera, which is a comprehensive genomic profiling test. We are also exploring early cancer detection options for patients before they become symptomatic to have the best chance at cure, particularly in patients that are high risk or have those hereditary cancer mutations. It's an exciting time for the genetics field to move into a more personalized direction for cancer surveillance and lifetime cancer care. Back to you, Stephen.
Thank you, Dr. Wooden, for being here. Now, in the event cancer does come back, it may become critical to find new ways to treat this disease. When standard care regimes have been exhausted, patients can turn to clinical trials and benefit from the latest science has to offer, all while contributing to innovations in care. Here to speak about the Colorectal Cancer Alliance's efforts to increase access to clinical trials, I'm happy to welcome our own Andrea Goodman and David Fenstermacher.
Thank you, Stephen. I'm Andrea Goodman, and I'm joined today by David Fenstermacher. We represent the research team at the Colorectal Cancer Alliance. Thank you for watching today's Blue Bag Lunch. Today, we've heard from industry partners about how they're working to improve colorectal cancer screening and treatment. The Alliance is also focused on innovation across every stage of one's path with this disease. We built a simple system that provides users with free screening recommendations, quiz.getscreened.org. We also recently launched a one-stop shop support hub for patients and caregivers, bluehq.org. Please check it out today and set up an account if you haven't already. And today we want to talk a little about our research to end this disease, particularly our work in advancing access to clinical trials. The Alliance has positioned itself as a convening leader in colorectal cancer research. This function is important because research can be siloed away from medical teams and clinics, and too often patients can't access the latest innovations. It's critical that the brightest minds are collaborating to solve the biggest problems, and then working together to bring them to the forefront, make sure patients have access. The Alliance has a strong interest in improving outcomes among Black and underserved communities who experience significant health disparities in screening and treatment. One area of focus that has the potential for great impact is awareness of and access to clinical trials. We know that Black Americans are underrepresented in clinical research, and the effects are serious. Not only is this population not fully benefiting from cutting-edge research opportunities, but the research itself won't reflect all people. David?
Thank you, Andrea. Our goal is to increase clinical trial participation and save lives. Towards that end, the Colorectal Cancer Alliance created the Clinical Trial Think Tank that convened leaders from across the research spectrum, including the White House Cancer Moonshot, the National Cancer Institute, major pharmaceutical companies, and local oncology clinics. They met, and what we learned from that meeting is now being disseminated by the Alliance. And it includes bringing more awareness to positive trial outcomes and clinical trials as a regular care option. A call to message clinical trials outside of the patient's population so that we develop a broader awareness. And as the patients often hear about a clinical trial when it's too late to be beneficial. Also, efforts are needed to increase the understanding of clinical trials among the healthcare provider community themselves. And we need to understand exactly not just what the recruitment is, but what really happens during the trial itself. We need industry standards that monitor the trial experience for patients so that it is consistent across the care, no matter where you get it. And we also need to develop greater navigation for patients. Getting recruited into a clinical trial can be very complex. Having professionals that can help navigate you through the process so that you have the best overall experience and better outcomes is what we're all trying to achieve, and navigation can be a key part of that. That's just some of the takeaways from the day-long summit. The communities were focused and will be benefited by the work to convene experts and identify gaps in the clinical trial recruitment, experience, and follow-up. The Alliance is taking action to incorporate these key findings into our work, even this year, and we are encouraging healthcare providers and systems to do likewise. Innovation is needed, innovation is possible, and the Alliance, in partnership with leaders across the country, is ensuring innovation happens to benefit the colorectal cancer patient community. We'd like to thank you for tuning in to the Blue Bag Lunch today. Happy National Colorectal Cancer Awareness Month. Thank you very much.
Thanks, everyone.
Thank you, Andrea and David. That is all we have time for today, but don't worry, we still have trivia. Try out your CRC IQ, and we will see you next week.